Hi, this is Dr. Desmond. I want to talk about abnormal liver function test today. So when someone see a doctor or do a health screening or they have some tummy pain and do a blood test, very often we add in a special test called liver function test, also called liver profile or liver panel. So that we normally prefer to call it liver profile or liver panel because the blood test, the LFT, is not exactly a function test. It is to test for any profile, okay? So in the liver function test, there are several markers. First is a bilirubin. Bilirubin is cleared by the liver. So when the liver is sick, it doesn't clear the bilirubin, it becomes elevated. Second is albumin. Albumin is produced by the liver. So when the liver is sick, it produces less albumin. Number three is called alkaline phosphatase and gamma GT. These two enzymes, they store in the liver cells. If the liver bile duct, either the main bile duct or the small bile duct are blocked, like having a stone in the bile duct, having gallbladder infection, having a liver cancer, liver abscess, then the ALP and the GT may be elevated. ALT and AST are found in the liver cells. So when the liver cells are broken up, or level in the cells are being released to the bloodstream, so the level will be high. So that when people have acute hepatitis or have a virus infection, ALT AST can go up. So this is called the liver profile. So if you there have been friends, colleagues, or some patients come and show me, doctor, this is my liver profile. What do I have? Unfortunately, my standard answer, or rather answer for most doctors, will be, I'm sorry, I don't know at this time. Why? Because the liver function test or liver profile only tell you what happened to the liver. If it's normal, the liver is probably good. But the liver, when it's abnormal, it just means there's some issue. It doesn't tell you what's the cause of the issue. So there are few things that we have to know. Number one, when you have an abnormal liver profile, it doesn't necessarily mean that there's a liver problem. For instance, there's a genetic disease called, or genetic condition called Gilbert syndrome. They are high bilirubin, but they are perfectly fine. Or when somebody had what we call hemolysis, the red cells are breaking up, it's a hematological, a blood problem, but yet it is reflected in the liver profile. So high bilirubin can also mean hemolysis. ALP, besides being elevated when there's a bile duct blockage, it can also go up in people having a bone problem like a recent fracture or osteoporosis or something wrong in the bone, or it can also go up in people who are pregnant. Gamma GT, it can go up in people having bile duct problem, but gamma GT can also go up in people that take certain medication, people that drink a lot of alcohol, or people who are overweight. So it's not specific. ALT and AST, besides being found in the liver, they are also found in the red blood cells and the heart and the muscles. So in people that say they run a marathon, there's some muscle damage after they run a marathon, or they run, or they take part in the spin class, they cycle very, very fast for say 1 hour, the muscle being damaged by the extreme vigorous exercise, the ALT AST can also go up. And the liver is like a punching bag. When there's a problem elsewhere, like a dengue fever or COVID infections, for example, liver function test can be abnormal because of an infection elsewhere as well. So to sum up, a liver profile got many panels. From the pattern of it, whether bilirubin, ALP, gamma GT, ALT AST, we can roughly guess what type of liver problem. But it is not specific to the liver. You can have a non-liver issue, non-liver problem, and yet the abnormality show up in the liver profile. And even when you have a liver problem from an abnormal liver profile, the liver test doesn't tell you what it is. We often have to look for other things. So for example, if it is a ALP gamma GT up, we ask ourselves, it must be a bile duct problem. Is it a bile duct blockage? Is there a stone in the bile duct? Is there a pancreatic cancer that blocked the bile duct? Is there a liver cancer? Is there a liver abscess? Or is it purely because of a recent fracture that the ALP goes up? Or is it because he drank a lot of alcohol that make the gamma GT go up? So there are many possibilities. Often we have to do a scan, either an ultrasound scan or an MRI scan to find out if there are any blockage in the bile duct or the liver. And even if the ALT AST up, we suspect it's hepatitis or liver inflammation, we still have to do blood tests on A, B, C, and E, or other inherited problem to find the cause. To sum up, if we have an abnormal liver profile, as a doctor, we ask ourselves, can that be caused by something outside the liver? If with the liver, depending on the pattern of the liver profile abnormality, we will decide what is the next step. Should we do a scan or should we do a blood test? And the blood test can be plentiful. And sometimes the blood test, first round of blood test come back may be negative. They say, hey, we check for the common things. If we always have this same common thing or go commonly, the common thing is negative. let's go for further down to find out what's the negative, what is the second line of test, okay? So if you see a doctor with an abnormal liver function test, you expect an answer to be given to you within the same consult. I'm sorry, most of the time it may be, but most of the time it will not be. We often need a lot more tests to find out what is the exact cause, what is it not due to, what is it due to. So if don't expect an answer after one consult, don't expect the doctor to give you the answer straight away. Very often further tests is done, more blood tests, a scan, maybe has to spend hundreds to thousands of dollars maybe needed to find the exact cause of the normal liver test, okay? So to sum up, liver function test, liver profile, liver panel, if they're not normal, very likely a doctor cannot give you an answer straight away. Often we need a lot more tests to find the cause. Be patient, okay? This is Dr. Desmond.